Hello, my name is Melissa Devine, and I am with the Medicare Medicaid Assistance Program, often referred to as MAP. Today, we're going to talk about getting the most out of Medicare programs that can help you. What we'll cover is who MAP is, what we do, benefits of the LIS Extra Help Program, benefits of the Medicare Savings Program, and how to apply for both. Let's start with the Medicare Medicaid Assistance Program, or MAP. The Medicare Medicaid Assistance Program is comprised of unbiased counselors located all across Michigan. We offer free health benefits and counseling assistance. Our counselors are certified and have been trained in healthcare benefits counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they're not licensed to sell insurance. In many states, MAP is referred to as the State Health Insurance Program. So how can a MAP counselor help you? Well, they can help you understand Medicare health plans, compare and enroll in Medicare Advantage, compare and enroll in Medicare prescription drug coverage, identify and report Medicare and Medicaid fraud and scams, and assist with enrollment into low-income programs. Now let's look at the Extra Help Low-Income Subsidy Program. This is going to be help with Medicare prescription. Costs of Medicare Part D drug plans can really add up. You've got your Part D plan premium, the deductible, the prescription copayments, and coinsurances. And with poverty among the Medicare population at nearly half, having an income under 200% of the federal poverty level, many are likely eligible for the LIS Extra Help Program. The average value of the LIS Extra Help Program for an eligible person is $5,000 a year. LIS allows people to be able to get prescription coverage. Without this program, many low-income seniors will forego their Part D coverage and will not take the medications that are necessary to remain healthy. It also allows for a continuous special enrollment period. That means that a beneficiary can make a change to their plan once every 3 months, and they don't have to wait for the next open enrollment period to do so. It also waives any late enrollment penalty premium for Part D and protects people from the Part D coverage gap. Social Security Administration and Centers for Medicare and Medicaid Services work together to administer and educate the public about LIS and Extra Help. While Social Security handles the application and eligibility determination, CMS, or the Center for Medicare and Medicaid Services, administers the program. They're going to handle the Part D plan assignment for those that are eligible and coordinate the subsidy to the Part D plans for the eligible enrollees. So in order to qualify for the low-income subsidy or Extra Help program, there are some eligibility rules. First, the person must have Medicare Part A and or Part B. They must live within the United States. They must meet the financial eligibility criteria, which is income and asset test based on annual federal poverty levels. And while some may automatically qualify for LIS, like Medicaid recipients, once you're eligible, you'll get LIS for at least the remainder of the year. There's a couple different levels of help from the Low-Income Subsidy Extra Help Program. Of the two levels, there's full help, which is the full subsidy. That's for those with lower incomes and fewer resources. And partial help, or the partial subsidy. That's for those with slightly higher income and resources. Either way, both levels eliminate the Part D coverage gap, and they eliminate the late enrollment penalty premium. This is a look at the financial requirements in order to qualify for the Extra Help Low-Income Subsidy Program. These numbers are effective January 1st, 2022, but as you can see, somebody who is Medicaid eligible, meaning they are qualified for Medicaid as well, has a stricter income and asset limit, but the benefits they receive is no monthly premium within the guidelines of what the low-income subsidy covers, no deductible, and their medications are $1.35 for generics and $4 for brand. For those that are not Medicaid eligible but qualify for full help, the income limits for a single individual is $1,549 per month, with the assets at no more than $9,900. For someone who's married, the income level is $2,080, and assets are no more than $15,600. Receiving full extra help will also provide you no premium within what the low-income subsidy will pay, no deductible, and $3.95 for your generic medications, and $9.85 for your brand medications. For someone who receives partial help because their income is higher, or their assets may be higher, the single individual monthly income limit is $1,719, and assets no more than $15,510. For someone who is married, the income limit is $2,309 per month, with assets no more than $30,950. It provides a sliding scale premium with a $99 deductible and medications at a 15% copayment. For the income test of the low-income subsidy extra help program, Social Security is going to look at the following as countable incomes: the Social Security benefits you may receive from retirement or SSI, and if you're a retiree from the railroad, then they're going to look at your Railroad Retirement Board benefits. They're going to look at pensions, annuities, including any veteran pensions, any gross wages or earnings from self-employment, alimony, rental income, and workers' compensation. Items that they will not look at are SNAP, which is your food stamp benefits, any fuel assistance benefits, $20 monthly in unearned income, such as Social Security, and work-related expenses for people who get Social Security benefits for disability or blindness. For resources or assets, the countable assets or resources include financial institution accounts like checking, savings, and CDs, any cash that's at home, any stocks, bonds, savings bonds, mutual funds, IRAs, and 401ks, real estate equity value other than your primary home, and certain trusts that allow a person to revoke or have direct use of funds. The items that are excluded from the resource or asset testing include the home in which the applicant lives, all vehicles including automobiles, trucks, motorcycles, boats, snowmobiles, etc., household goods, furnishings, and personal effects like jewelry, any cash surrender value of a life insurance policy, any in-kind support like non-cash help such as shelter, and irrevocable burial trusts or burial contracts. There's a couple different ways to apply for the low-income subsidy extra help program. You can do so online at Social Security's website through ssa.gov. They have online applications available in English and Spanish, and they'll accept an electronic signature to complete the application. Or you can complete a paper application, which you can receive from Social Security. You do have to call Social Security in order to get the paper form sent to you, but you can either mail it or drop it off at the local Social Security office. Social Security does make the determination for the applicant, typically within 3 weeks of the completed application. Some tips of the trade when applying for the low-income subsidy or extra help program. Online is usually easier and faster. If you can apply online by yourself or with the help of a MAP counselor, you can get that online application in really quick and get that determination faster. There's no verifying documents that are needed, and if a paper form is incomplete, Social Security will follow up via phone with the applicant. An online application cannot be submitted until it's completed. Now let's take a look at help with Original Medicare through the Medicare Savings Program. Assistance through Medicaid with the Medicare Savings Program matters because Medicare isn't free. Medicare is the primary insurance for seniors age 65 and older, and for many younger adults receiving Social Security disability benefits. And for many, Medicare can be unaffordable. But Medicare is not free, and the out-of-pocket costs can add up. So what are Medicare savings programs? They are Medicaid-administered programs that help cover Medicare premiums and cost sharing. For those with Medicare who have limited income and resources or assets and do not qualify for full Medicaid. Medicare savings programs buy those who are eligible into Medicare Part A, B, or both. So who's eligible? Well, you must have Medicare Part A. You must meet the income and resource eligibility testing. You must submit an application through the Department of Health and Human Services, and your eligibility is generally redetermined each year. Within the Medicare Savings Program through Medicaid, there's 3 programs that beneficiaries can qualify for. The first is Qualified Medicare Beneficiary, or QMB. That program is going to help cover the cost of the Medicare Part B premium, the Part A premium if you're not receiving the premium-free Part A, and all Medicare Part A and B deductibles, coinsurance, and copayments. Then there's the Specified Low Income Beneficiary, or SLMB, and that's going to help cover the cost of the Part B premium only. The last Medicare Savings Program option is the Additional Low Income Medicare Beneficiary, or ALMB, and that is where they're going to help pay the Part B premium only as the funds are available. This is a look at the financial criteria in order to qualify for the Medicare Savings Program. The financial eligibility criteria is effective April each year, so these numbers are for April of 2022. And the income limits for somebody qualifying for the highest level of subsidy out of the 3, which is QMB, is $1,153 for a single individual and $1,546 for someone who's married, with resources or assets no higher than $8,400 for someone single and $12,600 for someone who's married. Again, the QMB program is going to help pay for the Medicare premiums, deductibles, and copayments. And there is no retroactive coverage. For somebody qualifying for the second level, or SLMB, the income can be no more than $1,379 monthly for someone single and $1,851 per month for someone married. Again, the resources are $8,400 for someone single and $12,600 for someone who's married. And SLMB is going to help pay the Medicare premiums with 90-day, if eligible, retroactive coverage. Now for the lower end of subsidy through ALMB, that is going to be an income no more than $1,549 per month for somebody that is single, and no more than $2,080 for someone who's married, with resources still at no more than $8,400 for a single individual and $12,600 for somebody who's married. Again, ALMB will pay for the Medicare premiums as the funds are available, with retroactive coverage up to 90 days if eligible. So how do you apply? Well, you can complete an application through paper form and drop it off at a local DHS office, mail it in, or fax it. You also can do an online application through michigan.gov/mybridges. You will be required to provide proofs like a proof of identity through driver's license or social security card, a proof of income and assets, which can be bank statements, pay stubs, and of course, if you have other insurance like Medicare, they are going to want to see that Medicare ID card. We're here to help you. If you want to speak with a counselor about your specific situation, give us a call. We're currently counseling over the phone and Zoom with some locations opening up in person. And our services are confidential and unbiased. There's no question that's too trivial, and we often deal with the very complicated questions as well. Our MAP counselors are trained staff, and they can help you. So give MAP a call at 800-803-7174. Let's get started. And of course, if you have any questions today on anything that we talked about, feel free to reach out to me directly. My name is Melissa Devine, and you can reach me at mdevine@aaa1b.org. Thank you so much for your time today. You guys have a wonderful day.